morning. My name's Sharon MacDonald and I live on the west coast of Scotland on a small island called Bute. And I am delighted to be here at ERA 2024 in Berlin. I am a patient living with atrial fibrillation and heart failure. I am also a patient member of the ERA Forum and the ESC Patient Forum. I am here with Dr. Matteo Anselmino from Turin, and I would like you just to tell us a wee bit about yourself, Matteo.
Hello, Sharon. Very nice to be here.
Nice to meet you.
I'm Matteo Anselmino. I'm a electrophysiologist and I'm associate professor at the University of Torino, Italy.
Great. Lovely to meet you. And it's nice to be here on this lovely sunny day, isn't it? So I was wanting to ask you a few questions about how you would actually recognise if you had atrial fibrillation. So the first question I would like to ask you is, what types of symptoms would a person suffering from atrial fibrillation typically have?
So symptoms in atrial fibrillation are very various. And the most common symptom is heart palpitation. So you maybe feel your heart pounding, fluttering, or running, or even more, you feel a missing beat. That is very typical. On the other side, the subject may have a fatigue. That means that for a normal activity, he will require more effort, and he will recognize that everything comes a little bit more challenging compared to normal. On top of this, also breathlessness may occur. So maybe not at rest, but you have a mild to moderate exercise when you realize that your breath is missing. These are common symptoms. More rare symptoms are like dizziness, or even the fact that you may have some chest discomfort. These are more rare, but these activate the worries of the patients. On the other side, as I said, it's very various. There's about 20-25% of subjects that have atrial fibrillation with no symptoms, so they are completely asymptomatic.
Yes, yes. So that's important to know the symptoms, but what that takes us on nicely too, is it important to take your pulse regularly? Well, and how do you go about, can you show us how to take your pulse? Yeah.
Sure, absolutely. Great question, because taking their pulse is very important. You may have a fast glance of your cardiovascular health. It's a very simple procedure, actually. You just press your two fingers on your wrist, on the palm up, on the thumb side, and you actually measure the pulse for 15 seconds. If you count your beats, then you count 4 times more. So if you measure 15, it will be 15 times 4, so 60 beats per minute, and you really know that your beats per minute are more or less normal. The normal range will be between 60 and 100. And a very important aspect is the regularity of the beat. So atrial fibrillation, for example, will be highly irregular. So perhaps the beats will be low or high, but even more importantly, they will be irregular. So this obviously does not substitute professional visit, but it may give good indications on your cardiovascular health. So yes, absolutely, yes.
Very important, I would say. I've just measured mine there, it's about 67, so perfect. I'm okay. Yes. So that's bringing us on. What treatments would be offered to people that have atrial fibrillation?
So treatment varies. It depends on the degree of the symptoms and also the underlying condition. But there are some common options for the treatment. First of all, blood thinners, anticoagulants, because the number one risk in atrial fibrillation is that the atrium is not properly contracting. And so, in fact, we have to avoid the risk of stroke. On top of this, we want to regularize the rhythm. So drugs like beta blockers and channel calcium antagonists are drugs that may be given. On top of this, antiarrhythmic drugs to maintain and restore the sinus rhythm. If the atrial fibrillation is acutely occurring, or if these antiarrhythmics have failed, then we may offer a cardioversion after sedation or a transcatheter ablation to maintain sinus rhythm more on a long term.
Thank you very much, Matteo. That's all for us having a little chat at the moment. So thank you very much, and keep taking your pulse, people.
Thank you.
Goodbye.